and gentlemen, without further ado, let's now kick off with our next panel discussion. My name's Amandeep, and I have the pleasure of being the MC for M42 on their main stage here at Arab Health all of this week. And occasionally, they give me the delight of moderating panels. I see some of my wonderful, illustrious speakers in the audience. This is great to see some familiar faces and some new faces. We have got such a range of topics that we're doing a deep dive into. I'm pleased to say that the experts behind me, they're the ones who are going to be sharing the very latest medical innovations, and I'll be here to guide you all through and navigate you through. Allow me to introduce the next subject matter is Orthopedic Innovations Advancing Scoliosis Care. Now, allow me to now introduce my panelists. Dr. Hassan Baydun, the head of Department Orthopedics and Sport Medicine, M42, and many other entities that we'll be hearing about today. Dr. Waleed Hakal, the consultant spine surgeon at HealthPoint Hospital. Dr. Sandesh Lakal, the consultant spine surgeon, also at HealthPoint Hospital. And Professor Dr. Darren Lovell, the visiting consultant, orthopedic and spinal surgery, HealthPoint and Mubadala Health. Please do take your seats, gentlemen, and I'll be coming over here to moderate this wonderful panel. Now, Dr. Hassan, may I please begin with you? And if you can maybe set the top level scene for us in terms of when it comes to scoliosis, how large a problem is this, and what exactly are we talking about?
Thanks, Amandeep, for the intro. So,
the mic all the way up.
Scoliosis care is an extremely complex problem for a reason. One, it affects kids for the predominant care. It requires complex care at every single level, a big level of trust, and it requires a lot of commitment. So, when you identify those problems, you start working through them one after the other. There's never been any lack of funding when it comes to capital and infrastructure in the UAE. And we've been great at that. We have the flashiest, the best. Everything is at the top of the game. But when you look at the other pain points in the problem, that's where we failed in advancing the level. What M42 has done is actually commit to advancing that by bringing in world-class experts so that they make this place home, so that we can take it to the next level, put ourselves on the map.
That's fantastic. Thank you, Dr. Hassan, for setting the scene for us. And as you say, you have, along with M42, brought in the world-class experts. And on that note, to seamlessly now go on to Dr. Waleed, when we talk about this issue, we're talking about the nature, just a broad level of what's the nature of the scale of this issue and currently what is available when it comes to medical innovations before we start looking at the future of innovations.
Sure. So first, to identify the problem. Scoliosis is a three-dimensional spine deformity which involves lateral curvature of the spine in the coronal plane, the vertebral rotation in the axial plane, and the loss of the thoracic hypokyphosis or the thoracic hypokyphosis in the sagittal plane. The actual definition given by the SRS is a lateral curvature more than 10 degrees. So if the patient has got a curve between 0 to 10, that's normal. Anything above 10 degrees is classified as scoliosis. The commonest type we see in our practice is what we call the idiopathic scoliosis, and that represents about 80% of the types of scoliosis. The prevalence of that is between 2 to 3% of the population. The other types are the congenital and the neuromuscular, and they are less common than the idiopathic scoliosis.
Okay, Dr. Willie, that's really wonderful for us to get that insight from you about the nature of just how bad this, as some people call it, the sideways curve of the spine issue is. Dr. Sandesh, if I come to you, the scale of the issue here in the Middle East in comparison to elsewhere in the world, what would you say?
Thank you. I think it's much similar in elsewhere in the world. What I find in terms of as a problem or some is that the picking up the scoliosis or the screening of scoliosis is something which is not done appropriately, or the case is presenting a bit late is the commonest problem I find
Just
it
going to
here.
ask you to bring the mic all the way up, yes.
Yeah, basically the cases of scoliosis presenting slightly later is one of the key problems I find it here in comparison to the rest of the practice which I've had in the other areas.
And that's really important for us. That's a really astute point you make there. I am going to bring you in just a moment, but I want to hear from Dr. Darren before we go on. So this really is a key area for medical innovations.
Absolutely. And I just want to say thank you to Hassan and Waleed for inviting me to this panel. It's always a pleasure to be in the UAE and to work with such talented surgeons and doctors. So thank you. Scoliosis historically has been a very challenging issue to treat because it's required big open surgeries. And more we understand now that it's not just a curvature side to side, that it's a three-dimensional deformity of the spine. And that's where innovations in imaging are really helping us, not only in the screening of patients, but in terms of how we treat them during surgery. So bringing a lot of those technologies into the operating room so that we can treat them more precisely and better with better outcomes has really been a big innovation in the last few years.
That's really quite empowering information that you're sharing with us. So Dr. Waleed was talking about the actual nature of the problem, just how severe it is. Dr. Sandesh talked about how we need to diagnose it and ensure that we actually spot this so that we can have the medical innovations. And Dr. Darren there, you really painted the picture about medical innovations really being at the cutting edge. Dr. Hassan has been patiently waiting to come in, so please do. Bring the mic all the way up, though. All the way, sorry, because it's so loud.
Absolutely. So Sandesh only touched on part of the tip of the iceberg, because part of the bigger problem that we have right now is that most of this medical care is not staying within the country. Most of this medical care until recently was having to leave abroad so that we can get extremely complex surgery done elsewhere. And that brings us to where we started tackling that problem. Because you have to build trust with the patients, you have to deliver care which is seamless, spotless, helped by innovation, helped by the physicians who are going to deliver this care and keep the patients in here. It's a process which is not, it's a journey which is not going to change overnight. This is a journey which is going to take 5, 10 years. But I can tell you one thing, and I'll let the guys share more in depth. It's a journey which is already making strides in the region. We are practically bringing healthcare from the West back over here to the UAE through those experts next to me.
I think that's really interesting to hear this idea of this international collaboration. And as you represent Dr. Hassan, you work with so many of the big, strong medical institutes out here, HealthPoint, Mubadala Health, M42. So you have an insight in terms of exactly what's happening at the forefront. And you would say the UAE really is at the forefront here in terms of developing this technology and implementing it.
Absolutely. I'll leave it to Waleed to talk about his experience coming from the UK. He was a lead surgeon in one of the scoliosis centers. I'll leave it to Sandesh, pediatrics. Leave it to Darren, visiting us from special surgery, the top ortho hospital in the US. I mean, they can comment on the level of care that they are delivering over here.
Well, that seamlessly allows me to please bring in Dr. Waleed. Now, I know that we spoke off stage about this collaboration with M42, which is really known for being at the nexus of technology, sustainability, and health. Explore that issue with us there, how technology really could be the key to unlock the treatment.
I mean, recently there are too many advances, even before we talk about the AI. So starting, if we say that the plain X-rays was first invented in 1895, now recently in the last few years we started to have something called the EOS, which is a machine which can give us less exposure and more accuracy. In terms of modeling for bracing, even if you're not talking about surgery, there is now computer-assisted designs and computer-assisted machinery which give us the accurate type of the brace which is custom made for the patient and gets the best outcomes. Then that takes us to the role of the AI, and the AI is not just the what happens in theater. It can start from the level of screening, as Sandesh has pointed. We used to use methods like the Adams forward bending test, scoliometers. Now you have got softwares and algorithms like the fast RCNN and the residual neural networks. All of these can give us accurate assessment and accurate detection of early scoliosis, which is more accurate than the expert surgeons. And that can be included in the diagnosis, measurement of Cobb angles, you name it. So it has got its role even in the prediction of the prognosis. This is one of the commonest questions we get asked by our patients. What is the expectation of this curve if it's left untreated, or if it's treated by this method or that method? By AI, we can predict that accurately than by saying it's up in the air, we don't know.
That's really promising that the power of technology can allow early diagnosis. I am going to continue with my panelists, but just to say to the audience, we're going to open it up to your questions, so please have them ready, have your thinking caps on. I'm going to be back to you in just a moment. Dr. Darren, we talked about the power of AI and technology for early diagnosis. In terms of your expertise in medical technology, how else could it help the process of treating this very severe issue?
Yeah, thank you. So we can break it down really into two things. The first is to get the diagnosis correct, and the second is to execute the treatment. And that's really where technology is making a tremendous impact. So I always say to patients, this is not your parents' spinal surgery. We have very advanced imaging now, as Dr. Walid alluded to. Non-ionizing radiation at no harm to the patient to get the diagnosis correct and to screen properly. Our modern MRI scans that are run through deep learning protocols and can obtain bone-type imaging just with software. Really, that's the key, is to get the diagnosis correct the first time. And then the second thing is the execution. And that's where we can use these advanced imaging modalities to create 3D models of the spine, to put in our implants more precisely than we could in the past freehand. What we're seeing in spinal surgery is mechanization. Historically, surgery was craftsmanship. And more, as we automate that process with things like robotics, navigation, augmented reality, we can put in implants with sub-millimeter precision. And that's really where the future of this is headed, is the sense that we can get the diagnosis right, and then we can execute and confirm that before we leave the operating room.
That's really exciting stuff. Thank you so much for sharing this with us. Dr. Sandesh, we were speaking off stage about the future. What could be the future when we talk about what more can be achieved?
Thank you. The current state of technology, or AI in general, in the care of medicine itself is just like tipping in the toe, basically. It's very minimal. So the future for AI in medicine itself is bright because of advancement in computational capabilities and advancement in internet and faster access to internet, and the algorithm themselves are being rapidly advancing. Like the algorithm last week is obsolete now, and the next week will be something new. So the scope of innovations are humongous. Coming back to scoliosis per se, AI can bring an enormous amount of tools, innovative tools, starting from screening. I said in the beginning that screening or diagnosing early is key. For example, AI using image pattern recognition technology can predict whether the child has scoliosis or not by just having an app, just looking at their back image itself. That not only helps the family and child, but it actually can help for the frontline non-specialist carers as well. Moving on from that journey, from screening to diagnosing, that automatically as the x-rays are taken, you can have an automated AI-backed software which can assess all the parameters that is relevant to the care of the child. And moving forward, based on that parameters, it can actually suggest, as Walid was saying, that whether this child is likely to have worsening of this curvature, if that worsens, whether that needs a treatment, whether that treatment requires surgery or non-surgical treatment. So the option for innovation or the innovative tools in the future is humongous. I've not even touched about the AI and robotic and the combination what
And
can
we
can
might get
bring
a
as well.
chance to. I know Dr. Waleed and Dr. Hassan wants to come in, so maybe Dr. Waleed first of all.
Yeah, so I just want to add something about, if you want to
Yes.
summarize it about the role of AI in scoliosis, it's actually about the precision and the accuracy. Because if you look at the intra and inter-observer errors, starting from the diagnosis, identifying the proper cop angle of the curve, identifying the fusion levels, even AI can predict complications like proximal and distal junctional kyphosis, selecting the accurate fusion levels, even giving the proper linking classification to the curve. Because we see that there are different differences between consultants when it comes to that. Even it comes even on the role in the future of getting a pre-bent robotic as rods, so you can get the rod which is specific to that patient, or what we call the patient-specific template, which is custom-made for that specific patient. And then you get the best outcomes at the end. Not, as we discussed earlier, it's not just a lateral curvature, it's a three-dimensional deformity. Till now, we do not have a classification which has included the rotational component. AI can help us with that, because we are describing a three-dimensional deformity initially by a uniplanar classification, which was King's and Moe, and then Linke classification, which is from 2000, and that's a two-dimensional deformity. Now, with AI, we can get the proper, accurate classification, including the rotational component in the equation.
I appreciate your emphasis there, Dr. Waleed, on the words precision and accuracy, because it seems like that really is something to be celebrated. Dr. Hassan, you've been very patient, but nodding away, so please come in.
So, what you guys touched upon exactly, I think, brings us towards summing it all up into one. You have the physicians, a healthcare provider, Mubadala Health, who had a beautiful merger with an AI and genomics company to give us access to genomics, predictive models, so that effectively, one, we allow the physicians to serve the patients in a better and more precise way. I'm not expecting a robot to do the surgery, but the robot that's going to be helping my physician is going to allow him to do his job easier, better, safer.
And those can't be things that people would have a pushback to, but of course we do hear in general that sometimes when it comes to the health industry, there is still some fear about technology, and these types of panel discussions really are the way to dispel those myths and say that this is all about actually enhancing the work that can allow a better patient experience and allow for the medical professionals to do more of the job that we really want to give you more time to do. Now, speaking of time, we are running out of time, but our audience, brilliant. I love this, the enthusiasm. We've got at least 3 questions already raring to go. So do we have an extra mic, or shall we share a mic? Okay, maybe Dr. Hassan. Yes, thank you. Thank you.
You might want to turn it on. Sure. You might want to turn it on.
Can you hear me?
Yes.
Which artificial intelligence tools, if any, are you guys using in practice right now? And if it's still nascent, what's stopping you from embracing AI more wholeheartedly and really go at it?
Good question. And if you can pass the mic to the lady on the front, the next one. Oh,
Sorry.
maybe Dr. Sandesh first of all, because you.
That's a good question, actually. As I said, it's at the moment involvement of AI in clinical care is just about tipping a water in the toe. So the problem of barrier to involvement of AI in clinical practice is first of all availability of tools. We don't have the tools already. What we envisage will happen in the future. The second is the clinical efficacy of those tools itself. So in terms of I'm pertaining to the scoliosis care. In a broader aspect, I know there is plenty of AI tools are there in pattern recognition and imaging. From scoliosis per se, I think at the moment we don't have any specific tools as such, but the future is definitely bright.
Dr. Darren?
Yeah, thank you for the question. I think it's important not only the question, but who's asking it. I've worked with Andre, who's developed AI software to help automate MRI scans, and so there's a little bit behind that. But those are exactly
So we
the
need him on the panel next time.
right. But those are the types of things. I mean, we're surgeons, and a lot of this requires partnership through organizations like M42 and with industry. Broadly speaking, the things we're doing are automating the imaging, so taking the subjectivity out of it. There's no reason we should rely on a radiologist report to say mild, moderate, severe. I mean, that's very unscientific, and that's where the software can help us at a first pass. Not to mention our imaging in the OR. We can quantify what we're doing. It shouldn't be descriptive like a piece of art. It should be very scientific. And so those are the types of things we're looking to partner with industry on.
Fantastic. And Dr. Waleed, would you like to add anything on this point?
In terms of the usage of AI, I agree that we haven't started yet. But in terms of intraoperative tools like navigation systems and robotics, Darren has used the robotics. I've used already the navigation, and in the near future, we'll be starting robotic surgery at our hospital.
And Dr. Darren?
I don't think I have to tell you or this audience, most of the innovations I would submit in surgery in the next 10 years are going to be software. Not all. I mean, there's some very exciting things in biologics, implant design, material science. But a lot of what we're doing is software with predictive analytics and being able to counsel patients at the beginning what to expect afterwards, which is so important.
And that really underlines the importance of discussions like this. Our two ladies have been very patient, so please do.
Thank you for outstanding presentation in such a difficult topic. My concern here is that, as we know all, there is a new era in the world called epigenetic medicine, which is a collaboration between nutrition, exercise, and regenerative medicine. Do you think there is a role for such epigenetic in the scoliosis, especially in the cases which are challenging for surgery? Still, we know that there are many cases that they are challenging due to comorbidities or any difficult issue. They will not be under anesthesia, so there will be no surgery. Do you think there is role for epigenetic in scoliosis in this issue? Thank you.
It's a very strong question. Who would like to take that?
It's a fully loaded question, to be honest. It's the children who we deem as not safe for surgery are complex children to start with, and they have hosts of medical comorbidities. And epigenetics. I mean, if you take SMA, there's already genetic treatment has advanced and genetic treatment exists. But to be honest, my awareness of that particular aspect, I'm sure there will be a role. I think there is further research has to be done. In the concept wise, if you think about it, it does make sense. That much I can say.
I mean, not talking about the genetic based problems. No, you know that most of the studies recently are showing that even what we consider as idiopathic scoliosis, which represents 80% of the types of scoliosis we see, can be genetically based. And there are many studies done in Montreal and Toronto and Canada about it. If you even Google the zebrafish, they have created scoliosis in the zebrafish because it's got the same genomic sequence like in human beings. So there are lots of work which will be coming in the future, which can make us jobless in the future because it can be treated by tablets or whatever. And then if they identify the proper genomes and the proper problem, that we are still not knowing what's the cause and call it idiopathic. But I think in the near future, it can be identified and it can be even treated even in utero basis.
I'm loving these questions, and the lady at the front, very patient. So we're going to go to her, and then you can jump in, Dr. Hassan.
Yes, so I'm Dr. Azza, a clinical geneticist, and I would like to ask you about a question. Do you include the genome screening in your investigations before the operation, especially if you have congenital anomalies, which can be, of course, of genetic origin? And the second question, does it affect your approach later on during the operation? Would it be different, your approach, if you diagnose a genetic anomaly?
I mean,
Who would like to say that?
It's a very good question, but so far we have not seen congenital cases. So far, we have seen idiopathics and neuromusculars. But I understand your point that this is one of the things that we can include the genome studies in these patients in the future. But in terms of its affection on the decision making or management, no. So far it hasn't got the decision making is based on other parameters, the Cobb angle, the curve progression, and so on, and of course the other comorbidities associated with the congenital scoliosis.
and Dr. Satish.
Quick answer to your question. We will be asking your help in terms of in neuromuscular cases when we start doing surgery, mainly for antibiotic specificity with regards to neuromuscular cases, because the metabolic pathways for these neuromuscular children are different, and they don't react to the same level as the normal child would. So I think I did ask that question when you came in for Health Point, that what is the turnaround time for genetic testing in terms of pharmacogenetics. So pharmacogenetics is somewhere we will be interacting with you closely in the future.
Fantastic. That was such a powerful audience participation. I really appreciate it. And on that note, because we are officially out of time, I know that, of course, this discussion could have gone on for much, much longer. May I please ask you to join me in thanking Dr. Waleed, Dr. Sandesh, Dr. Hassan, and Dr. Darren, my wonderful expert panelists. I've really enjoyed moderating this. We're going to take a group photograph.